Welcome back to another movement video. This time we're just going to have a play with the idea that maybe we have one knee that's a bit more bent than the other. I see this a lot. I'll show you what it looks like. Apologies in advance if my head's cut off, but I find that hard to get everything in one screen. So we do the best we can with what we've got. Okay, so sometimes I see this quite commonly. I see that one knee is a bit flexed and the other knee is a bit extended. Side on, it might look a bit like that. That's a gross exaggeration, but even if it's a little bit, it makes a big deal for what comes above. So even if you look down at your knees right now, you might notice one thigh is slightly forward of the other. It can be quite subtle. You may not even know you're doing it. Often my clients don't know that they have this knee bent, knee locked pattern. We could go into the whys and the hows but let's keep it simple for today. I'm going to bend my left knee. Can you see that when I do that, if I keep my hands on my pelvis and I bend my knee, you can see that my left hand has dropped, which in my pelvis is now sitting like this. If I straighten my knee, my pelvis levels. I think that's quite obvious to see. Feel it in your own body. Have a bit of a bend, lock, and just let your pelvis drop, straighten the knee, and feel your pelvis rise. And then have a play on the other side. Back to the left. Now in this position, I have a hiked pelvis here and a dropped pelvis here. Hike, drop. Think about what that means for my poor old spine. The platform on which it sits is now slid, which means the vertebrae have to adapt to that. And what that normally creates is a facet joint opening and a facet joint compression. The hiked side will have compression, the dropped side will have space. Too much space can encourage a disc to bulge or migrate. Too much compression can encourage facet joints to wear out, for bone to thicken, which then creates encapsulation around the nerve roots that are exiting through the intervertebral foramen. That's not pleasant. That's when you have to have your laminectomies and blah, 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 or your discectomies. Can you see that if you have those surgeries, but the structure is still out of whack, are they going to last? How could they? What's probably going to happen is the next disc will go, or the next joint will wear out. Not saying these surgeries are a bad idea, but I guess I am inviting you to think, is my foundation level before I have the surgery? Maybe I don't need the surgery if I level out the foundation and I move from that space and I see how that feels for a few weeks. Might be too far gone. The damage might be too great. You may opt for the surgical intervention, and there's no judgment here. But I do think we need to think about setting you up for success post-surgery and making sure you've leveled yourself out, leveled out your structure, so that whatever your beautiful surgeon does can last. I think he would be happy about that too. And it can be simple as learning to extend your knee if it's flexed. I know this sounds stupid. I know this stuff sounds too easy, but it's very common. I see it all the time, and it floors me. I have patients regularly that come in and they've got the most advanced core workouts known to mankind. They're like impressive. Like I go, wow, that's an impressive movement sequence. I wish I could do that. It's not helping their pain though. I ask them to straighten the knee that's bent and to learn to walk from that position with two knees doing the same thing. Pain feels a lot better. I haven't strengthened anything. I've just improved their alignment in a very simple way. And this is what I want you to understand about alignment, alignment, alignment. It matters. It matters a lot. And it's simple when someone can look at you and go, oh, there it is. There it is. Just do this, just do that. Healing can be that simple. And it's just a missing bit that you may not even know exists. And I say that to give you hope. You may be sitting there now having tried everything except straightening your goddamn knee that's a bit bent and learning to walk and move from that position. And that could completely set your structures free so that they can heal without being provoked every time you take a step. Rant over. I'll get back to the exercise. Okay, so how could we start to A, become aware, B, find a wall, try and do this exercise with your feet under your hips and ideally facing forward, take your hands onto your hips and just start to feel what happens in your structure when you drop that knee. I feel a big lengthening through this side of my spine. I feel a compressing through this side. Then I'm going to do the other side. I've got you against the wall just so that you can keep things pure, just to make sure we're not trying to do this exercise while we're off axis, which would hurt like hell. When you're against a wall, you're on axis. I have another video about that somewhere on the channel. And just smooth up your frontal plane hike and drop motions. Simple, hey? I just wanted to give that one to you because it's a real simple, easy one. It may apply to you or not. As always, let me know if that's relevant to you, if that makes a difference. Drop below, comment, like, subscribe, do what you got to do. Let me know if you have some movement dysfunctions that you're curious about and whether they might be feeding into your back pain. And I'll see if I can record something just for you. Until I see you again, good luck with your back pain healing. And I sincerely hope that something I'm sharing is going to benefit you.